Everyone tells you you need experience to become a healthcare analyst, but nobody tells you which healthcare jobs actually lead there, which entry level, which near entry level jobs will be the best. So today I'm ranking the roles from weakest to strongest, and by the end, you'll know exactly where to start, even if you have no experience. My name is Jeff. I've been a healthcare analyst and consultant in a Fortune 5 company for over a decade, and I help people break into healthcare analytics by using entry level experience, AI, and insider systems to shortcut the job search. If you need help picking the right role and just breaking into healthcare analytics in general and turning that into real experience so that you can actually get hired faster, I have a free community called the Healthcare Analysts Accelerator and or Lab, and I'm helping career researchers build experience first portfolios to get hired faster. Link is in the description below. Apply and hope to see you inside. Also, a quick caveat before we start. This isn't every department in healthcare. Healthcare is huge. There are going to be broad categories that I'm speaking to that consistently produce analysts that I'll show you exactly why. So let's dive into these different categories. So here is which healthcare jobs actually lead to analyst roles. So I'm going to rate this in like different tiers. The first tier is going to be tier 3. And tier 3 is, in my opinion, going to be the weakest. It's not impossible. I know people who still transition in analyst roles from here, but you use it as a stepping stone to get promoted into a more data-centric role if your front-facing role doesn't have this. So it's going to be patient access. Oop. Ignore that. Patient access, and then front desk. And this is also going to vary by company because some of the front desk and scheduling people that I know have touched data a lot. So they get to wear a bunch of hats and do a lot of different things. If you get to go into one of these roles, the more that you touch the data, more that you get to do with the data and wear different hats, especially at very small companies where you get to do a bunch of different things. These are going to be better entry level points for you. So these jobs usually aren't direct analytics pipelines, but it depends. If you're touching a lot of structured data, then it could be. But what you are learning here is you need to learn the business of healthcare. You're learning the operational workflows. You're learning things like billing. You're learning insurance, how to navigate their insurance, eligibility, scheduling patterns, and also patient throughput and also patient demands and their different medical records and all of the different services that you're going to be providing. And that matters because analysts spend their entire careers explaining these workflows with data, and then you get to be in the front lines learning it firsthand. So you want to think about these as more of a stepping stone than a destination so that you can get into a more data-centric role. So the next one we're going to be talking about is tier 2. So tier 2 roles are going to be call centers, member services, and then G&A, which is appeals and grievances. This is services, and then this is G&A, appeals and grievances. Also, there's going to be different roles that are going to fit underneath here. Think of this more as like a broad category. Various roles that fit in here in various departments. You'll have member services, and I've seen people transition from member services from being a call center rep. Appeals and grievances because they get to work with you get to work with the nuances of the healthcare system because this is where people are going to come and complain. And then you get to see like high impact cases inside this area. Then you also have workforce management. And then customer experience operations. We'll just say customer experience ops. And then you also have quality assurance QA review. So this could be these departments, there could be roles within these departments. Here, what's nice about these roles is you get to touch, you're a step closer to analytics. A lot of these analytics teams will work with these teams. For example, I work with some of the data processes that I work with affect thousands of member services, call reps, appeals and grievances. There's certain things that I'll be doing for appeals and grievances to make their processes easier. So then if you can be at the front line of where that data is touching, and then how you'll be able to work with analysts and understand the back end processes, it gives you a step to transition to those roles, especially if you work for a bigger company, or you can transition into a bigger company once you get these types of roles, because these departments are massive and they generate a massive amount of structured data. So think call categories, handle times, escalations, complaints, resolutions, and then you're going to start to see more of the business side, business workflows, trends, patterns, systemic issues, and it'll naturally build in the domain knowledge of where the revenue is coming from, how the business, the health system works, and then you get to understand more of the nuances that you'll need as an analyst that will be important when you're applying to some of the roles later. It builds in that healthcare domain knowledge and data intuition for the specific system that you're going to be working in. So these roles can naturally transition into operations analysts, quality and performance analysts, and other analysts that are related to the specific department, or even cross departments that you'll be working with. So you're not just going to be responding to problems, you're seeing the data behind them, and then you can transition into the teams that are helping you in the analytics side and the business side. So another one from here and would be, let's call this tier 1B. This is going to be provider operations, referrals, you have networking, and then you also have quality. This represents a very, very broad base of various departments and potential roles. So the different roles that you could see under here would be a referral coordinator. So referral coordinator. And then you have provider relations. When I first became a data analyst, I worked with provider relations a lot in pulling the data for their clients and the different metrics that they needed for the different providers that they were working with. You have credentialing, which is another revenue part of the business, because there's going to be certain things that you would have to know in terms of like various contracts depending on the company. And when you can get tied to and learn the business process of where the revenue is coming in, or like the contracts and the nuances of the business, you'll begin to understand more parts of the business and be able to transition into analyst roles in various parts of healthcare. You also have network management. And this could be anything from different parts of insurance to formulary, PBM, and pharmacy management, network management. So this spans across a lot of different niches as well. You also have quality. And this is across a lot of different things, quality and performance. And then it's usually tied to improvement. And this could be tied to certain quality metrics. It could be tied to CMS stars, anything that relates to Medicare, Medicaid, and then a lot of different government programs could fall into here because of the revenue that's generated or budgeted to these programs, depending on how well you do. And then you also have care coordination support. So this can be a lot of other roles. You get to learn the health system, you get to learn how to navigate it, and then learn how to coordinate care for various patients. And then you learn the data behind that. And then you can also use that knowledge, that clinical knowledge, and transition into the admin analyst route later. And what's nice about this is this tier puts you right in the middle of clinical operations and the various operations and admin side. You'll be able to understand provider performance, incentives, network adequacy, referral leakage, credentialing timelines, and also turnaround metrics. So these workflows feed directly into analytics teams because leadership needs dashboards for access of care, provider performance, incentive metrics, quality reporting, throughput issues that will go either on the payer side and then or on the other side as well. So these roles give you process level thinking, more of the business insight and revenue generation or lack thereof. And then it's also one of the predictors of analyst success because you're tied directly to the quality performance of a health plan, the clinics, and then other providers within the space. Which now this is going to bring us to what I consider tier A. This is going to be tier 1A. And this is going to be one of your fastest and strongest pipelines. Anything that touches claims. Plus prior auth. And what's important about prior auth and claims is, or plus UM. UM is utilization management. These are important concepts inside the healthcare system. Claims is basically how everyone gets paid. You can put a claim into the system, and then depending, I'll go into this in the future video, but basically you get to follow the money in the whole system because there's going to be a variety of different claims to understand. There's pharmacy side, there's the insurance side, there's the medical group side. There's a lot of claims and like how benefits are paid out and how providers are paid out. And then being able to understand this will be able to get you into a lot of different roles. Same with prior auth. Basically, inside the healthcare system, depending on your care and the system that you're in or your health insurance, you might need a prior authorization to get certain levels of care. It could be anything from a screening to seeing a specialist to anything else. Certain medications will require a prior authorization. And there's decision trees, there's complex things that go in the prior auth, and it depends on the niche of healthcare that you're in. But that's why understanding prior authorization at a deeper level will also open a lot more doors. Same with the utilization management. This spans a lot of different niches. On the pharmacy, the PBM side, which is the pharmacy benefit management side, it's going to be things like prior auths are included in here. They could be step therapy, basically the different drugs you have to take before you get another drug, or quantity limits, which is the max quantity for those drugs in a certain period. And then this spans a lot of nuances and a lot of different business logic. So there's a ton of data in all of these, and a lot of business is generated or costs is saved through these three departments, and broadly speaking, these broad categories. So understanding them will help you break into healthcare analytics, because a lot of courses don't teach this. They just teach general analytics. So this is one of those things that if you can get the experience in, it'll help you transition into an analyst role. So things that you could see inside here, there are a lot of different roles that you'll see in here, but basically a claims processor, what else is here? Claims auditor, claims investigator, And to get these roles, not all of these roles are going to be entry level. You're going to have to get experience like at the ground level on like some other entry level job and then transition your way into some of these. Claims processor you might be able to get into, customer service into claims processing, but usually you might have to transition into these roles. Risk adjustment support, this is where I started. It's a very niche part of healthcare. Risk adjustment basically is, if you know what medical coding is, medical coding is how the government budgets for Medicare by patient and how they pay out each provider. Risk adjustment is how they assign a risk score to each chronic condition, and then they have the whole budget for Medicare, and then that score will allot a certain amount of money to those patients, and then it gets paid out to the providers by the health insurance. So this is actually where I started, was in risk adjustment support. I was the assistant to the data analyst here, and I was also doing temp data entry here as well. Other places, billing and revenue cycle, and then coordinator. Any coordinator roles within these departments will be places that you can start and potentially get in at the entry level. Clinical review support. This could be assistant reviews. This could be admin assistants. I know somebody who transitioned from front desk into a executive admin, where they got to, and then transition into clinical review and support. And then you could leverage that knowledge into an analyst role as long as you learn the technical skills. And then you also have pharmacy authorization. So these are just a few of the roles that you could see, but anything that you see that touches claims, prior auth, and then those are great places to get the experience so that you can transition into an analyst role. So you can think of these roles as like a top level jewel or top level transition into analyst roles. And here's the reason why: you're sitting next to structured data that healthcare systems run on. Claims alone have 30 to 60 data fields: diagnosis, procedures, providers, amounts, modifiers. You have a bunch of various complex codes, ICD 10, I think it's 11 now, 11 codes. You also have the revenue that's tied to it. You have complex systems and like understanding how to navigate the data and read it and pull out the trends that's necessary for the revenue, or where cost is being leaked, or being able to improve measures based on this, is where you're going to have an edge over people who are applying, who only have general analytics knowledge. So if you understand claims, you can understand the financial engine of healthcare. Same with prior authorization. If you learn the approval logic, the clinical criteria, denials, turnaround times, all things that analysts are going to model and report every single day, it saves the time of people hiring new analysts who don't understand the domain knowledge. So that's why learning all of this and gaining that knowledge gives you an edge. These are just areas that give you two things that analysts must have if they're going into these specific roles. It gives you deep data exposure and deep process understanding of the healthcare business. This is why people in these teams transition the fastest into analyst roles. So the closer, you just want to think of it this way: the closer that you are to data and the closer you are to the process equals a faster analyst transition. So it's not going to be the title that you start with. It's going to be how close you are to the structured data, measurable workflows, understanding the business, repeatable processes, and then real operational problems that analysts solve every day. So this is why career switchers succeed so quickly in healthcare analytics, is once you understand the process behind the data, tools like SQL and Power BI start to make more sense. And that's why I also know more people who are less technical, but they have the domain knowledge and they came from prior auth, they came from customer service. I know somebody who came from customer service without having a college degree and they became a healthcare analyst and now they have a thriving 6-figure career. So it's possible, but you have to work your way from the bottom and get the healthcare domain knowledge plus gain the technical skills to make sure you get promoted into a higher paying position. So now you might be thinking these roles make sense, but what does a healthcare analyst actually do with all of this data? And more importantly, how does their day look like when you finally become one? And because understanding the roles is step one, but understanding the job that you're aiming for is what will speed up your transition. So if you want to exactly see how data flows, the tools that I use or broadly use, and what I would do as a healthcare analyst and within my day job, you can check out this next video on what I do as a remote healthcare analyst. This is going to connect everything that you learned today and show you the next step of the journey. So click on that